Hello, LinkedIn, for another great LinkedIn Live. I'm delighted to have two great experts that came and shared during the COVID-19 summit last week, and we're going to have a very interesting and insightful Q&A session. We're going to take quite a few questions that popped up during the summit, but also, as always, I want to invite everybody to comment in the comment section on LinkedIn, as well as on the YouTube or on the event platform. Before we start, let me briefly introduce them again. So on one side we have Arnaud Bernaert, who is currently the head of global health and healthcare at the World Economic Forum. Many years in the industry, in the healthcare sector. He also worked prior to the forum. He was the vice president at Royal Philips, in charge of global strategy, business development, and M&As for Philips Healthcare. Arnaud, thanks a lot for coming on again.
My true pleasure.
And then we have Scott Ratzan, who is the editor-in-chief of the Journal of Health Communication, as well as the co-lead of CONVINCE, COVID-19 New Vaccine Information, Communication and Engagement Task Force. He has 3 decades of pioneering accomplishments in the US and globally in the field of health communication and health literacy, doing a lot of great things also in involving corporations and businesses worldwide in this effort of COVID-19 vaccination. Scott, great to have you, and thanks for making the time.
Thank you. Good to be here.
So guys, maybe let's start with, well, this question, and Scott, you have addressed it during the panel. Arnaud, this didn't particularly come up during your panel, but let's do it again, because there's some new audience on board, and there's been also some new vaccines that have been approved, like the J&J one. How safe is it, right? So this question that keeps popping out: are these vaccines safe? People are asking all over the world. What's your view from where you stand, and maybe a little bit in terms of the thinking around it? So I leave it to any of you that wants to start.
What do you, Scott?
Well, thanks. Well, Radu, thanks for the question. We've been working both in New York and globally with our CONVINCE initiative to try to understand where the people, the public and policymakers are in terms of input and intake and interest in vaccines. We do know that vaccine hesitancy has been an issue that was identified by the World Health Organization as a top 10 threat in 2019. We have done a number of studies, one that we published in Nature Medicine, of 19 countries, of looking what people's interest was in taking a vaccine. And unfortunately, the numbers are not great. The average is in the 70s, but between 55% in Russia, up to 87% in China. But those numbers are only part of the picture. When we've been looking at conducting other surveys, we continue to see the number one question people are asking: is it safe? Even safe comes up before effective. And the answer is that all of the regulatory authorities that have approved the vaccines that are already on the market have gone through the appropriate rigor and clinical trials and the review of that literature before they had approved those. Even if it's an emergency use authorization, whether it's in the United States with the Pfizer-BioNTech vaccine, the Moderna vaccine, as well as in Europe with the AstraZeneca Oxford vaccine, and even some of the others that continue to meet some transparency for regulatory authorities with the Sputnik 5 vaccine and the Sinovac vaccine, it does appear that all of these vaccines are safe. The effectiveness is a little bit of a question, and we're still waiting for time. But we are telling businesses with business partners to CONVINCE, and we are referring what all of the regulatory authorities have said around the world, that this is a safe vaccine, and the vaccine is what we need to get out of this COVID pandemic.
Yeah, maybe I would like to build on what you just said, Scott, because obviously people are a little bit worried because of the speed, right? But we need to understand what has happened during the past period. Just the US government has been splashing 11 billion in support of vaccine development. So, when you got a lot of money, you can do a lot of things that you normally can't do, including collapsing phases of development into that are normally happening sequentially, run them in parallel, which saves a lot of time. The other thing that we need to understand is, it's not like there was no knowledge on an RNA technology before the crisis. Actually, CEPI is a Coalition for Epidemics Preparedness Innovation, was already working on the MERS coronavirus vaccine based on mRNA technology. So it's not like everything started in the 23rd of January. It started before. So I think I've got immense trust in the way development have happened. And also, I think you need to also realize that, and it's quite unprecedented, this is the first time ever vaccines manufacturers have made public the clinical trials protocols. And that's also a way to demonstrate how trustworthy the development process have been, because this is all about transparency.
Absolutely. There's another point that I wanted to bring into the discussion, because now there's quite a few and a few different vaccines available with different percentages of efficacy and effectiveness so far that have been demonstrated so far. There's also the question that came in, right, in terms of which one should I take? Should I wait? Should I take the Pfizer versus Moderna versus J&J? Should I not? Obviously some have more like 60%, 70%, some are more 90%. Availability is an issue because you may not get, what you may hope for or wish for. Without necessarily naming any brands, discussion is not about that, but it's more like, what's your thoughts around, do I wait, what to do?
Arnaud brought up the most important piece, transparency and trust. And I think we need to trust the process and also trust that the vaccine that's available where I live, wherever that might be, is the one I should take, because the most important thing is to get as many people vaccinated as soon as possible. I've been doing these kind of town halls. I've spoken to people last week, New York, Brazil, around the world as this call, and people continue to ask this question. And my answer is, get the vaccine that is available. And if it is a 2-dose vaccine, get the second dose or organize the second dose, whether it's 21 or 28 days. It's so important that we get as many people vaccinated, because this also will slow down any potential new variants that will continue to show up, and could also make the current vaccines even less effective if we don't get people vaccinated as soon as possible. I see some promising goals and targets. The European Commission today said 70% of Europe by the end of the summer. It's a very hard task. I think companies need to set a target like that. I think many people can set a target. So whatever vaccine's available, procure the right amount if you're in that level, and help get your people vaccinated is the best approach.
Yeah, and I can't agree more, Scott. I think there is a big difference between the world reaching immunity in 2024 or the world reaching immunity in 2022. You can't leave those variants to continue propagate for a period of 2 years, because you know for sure that if you do, vaccines will be less effective at the end of the day. Now, to your question about which vaccine, I think obviously vaccination campaigns are organized by sovereign member states, and they do the right thing. So, when they have a doubt on the AstraZeneca potential for populations above 65 years old, absence of sufficient data, it's not because the data is bad. It's because they don't think they have seen enough data, and AstraZeneca will generate sufficient data, and they decide that they are going to privilege the healthcare workforce for these vaccines, like they're doing it in the country I reside in Switzerland, and they keep the Moderna and Pfizer vaccines for the elderly and the chronic disease patients. That's the right strategy. That's the right strategy. Now, there is one thing I would like to mention, because we talk a lot about 60 or 70 or 91 or 95%, but they have one thing in common, is that on the most severe form of the disease, they are all efficacious with in numbers in excess of 90%. So when we say that a vaccine is 60% efficacious, like it has been disclosed, I think we need to communicate fully. It prevents for the disease to happen in 60% of the individuals that will meet the virus. But for the ones that would have been very, very sick, end up in ICUs under ventilation, this is a 90% efficacy. So not only we reach we get a chance to reach herd immunity, but we are also protecting individuals, and that's very important. It's not only about herd immunity; it's about saving lives right now.
Well said, Arnaud. I'll take this question that came in because it's, again, I guess, a person in the street, me, you, all of us are wondering about this, right? And this is not going to be the same answer for all of the world at the same time, right? It's going to be countries and populations, I guess, and different areas. But what's your take on a rough kind of timeline, depending, of course, on countries and Western world versus developing world?
Well, I mean, the question is based on assumptions of what we know today and a lot we don't know. As the variants continue to come out and spread, and that will continue. The one thing that is certain, there will be more variants. This is a viral disease, and that will likely happen. If all we have is a vaccine in our arsenal, it is going to be very difficult for the world to reach that question of immunity. There may be other treatments that come forward, but I think Arnaud's point is right. We need to get people vaccinated to prevent the severity of disease, so we'll be able to live with some level of this coronavirus that we call COVID-19. And hopefully we could tamp down the symptoms to a level that we don't have the hospitalizations, we don't have the strain on the health system, and we're able to have the public health measures in place with a vaccine literacy. So people need to get this vaccine, they need to get a seasonal flu vaccine, they need to make sure their children have vaccines. We still need to get rid of polio around the world. There's lots of issues that are in play here, and we need to make sure that we don't sideline the scientific progress by some misinformation or disinformation that the vaccine is not good enough, or that the vaccines are not to the level that we want as quickly as we want. We all have to get around this together, and hence I think that's the discussion we're having today.
Mm-hmm. And to add to it, I think this is a moving target. This is a moving target because when people did believe you need 60 or 70%, depending on whatever models you had before. Obviously, if a variant does emerge that is more infectious than the original virus, then obviously your threshold is going to increase. That's what you're seeing in the UK at this point in time, where you start seeing, I would not say a significant portion, but say a portion of the population vaccinated, but you've never seen as many admitted in the ICUs, hence the need to vaccinate, because if you are vaccinated, you will not end up in the ICU. So I think this is a vicious circle to not vaccinate very, very fast. And the other thing, it's possible. It's possible. It's not impossible that this disease will become endemic. So that we will have to live with it forever, and that we will need to progress new versions of vaccines every year, like we do for seasonal flu, depending on the mutations we see. So hence the need to monitor those variants to understand how we need to adjust those vaccines. Now, the opportunity is to adjust those vaccines when it comes to mRNA, maybe in 100 days. So, or in any way, in less than 300 days. So you get the next generation of vaccines for the next season or the next emergence of variants. This is really the opportunity, and I know a lot are focused on that, including networks like CEPI or Gavi, monitoring very, very closely the evolution of the disease.
I'll stay with you for a second, Arnaud, because at the forum you're kind of sitting on top of all these discussions, and we got this question, right? Israel recently allowed Pfizer access to re-identifiable data of its citizen in return for preferred access to its vaccine. I don't know if this is true or not. This is the text that we got from the from the platform. But the question goes: do you anticipate future data diplomacy agreements? How do we protect the rights of members of COVAX or developing countries who are not getting the vaccine now?
I'm hopeful for COVAX. It's a macro level. It's the first of its kind instrument. Never happened before. Never. It took a decade for HIV patients in Africa to get access to ARV treatment that were available so much earlier in more developed countries. Now with COVAX, shipments are going to happen this month. I mean, this is a 2-month delay, not a 10-year delay. So I think I applaud what the likes of Seth Berkley or Richard Hatchett at Gavi and CEPI have done. We're very proud of having launched CEPI at the World Economic Forum in 2017. We did not believe it was going to be so indispensable in the current period. COVAX has secured commitment to provide 2 billion doses to the COVAX facility members, which is remarkable, getting them to vaccinate 20% of the population, the most vulnerable ones, before the end of the year. That's quite unique. But we need more doses. I mean, absolutely. The world needs to reach herd immunity, and that's where there will be many more doses that will need to be provided to COVAX. Certainly, probably 6 or 7 billion doses, which will need funding. So, funding, getting money to be provided to COVAX by the more wealthy member states of the UN system is a must. It's a must. I cannot comment on the Israeli information because I'm not aware of it, so I prefer to not.
I wasn't sure about it, but yeah, that's why I said. Scott, I will pull another question in terms of that came through. Well, it's kind of linked to. I guess it was touched upon. You touched upon it, both of you, a little bit earlier, right? Because it's not only the injections, right? There's a lot of other things that will come with it in terms of a lot of medical waste that will be produced. I guess this is a bit more technical, but we need to think also of the repercussions, right? In terms of all these knock-on effects, medical waste management, and all of that. What's your view on this particular point, Scott?
Well, I mean, thanks for the question. I think this also relates to what the last question was on data diplomacy. You know, I think we need to come up with what we call global health diplomacy, or just health diplomacy, which looks at the entire spectrum of how we deliver health. The health polity is huge, right? There's this insurance business, there's this waste business, there's all these pieces that are in play here. And we need to figure out with governments, with the right stakeholders, of how to address this and where the issues are. Yes, we need to prepare for medical waste, but that's not the major issue. I have been on other calls. It's interesting that this does come up, and it's, you know, notwithstanding, I think somebody ran the numbers on masks. Just if we have disposable masks, how many masks will we have? How do we, you know, is this going to be the next plastic bottles issue? Well, we can deal with all those. There are diplomatic ways, and there are ways that we could figure this out. So I'm less worried about that. I think right now we need to focus on the issue at hand. We have a pandemic that is raging. We have variants that continue to come out that are stressing systems where we don't have enough ventilators and oxygen in developed countries, notwithstanding what might happen in many others. So we need to focus on that now. Yes, we need to do that kind of planning just as we would in a business 3-year strategic plan, but we need to focus on vaccination right now. And I think Arnaud also mentioned something that was so key. This is a communication issue. This is an issue that we need to have everybody to understand. 1, that COVID is real. There are still people that believe it's not real. 2, that these vaccines are safe and effective. 3, it's not some weird conspiracy that's putting chips in or following people with privacy and data issues and so forth. And then 4, we all are in this together, and we have to make sure we don't just take care of ourselves, we take care of our communities, we take care of the families, we take care of people in our country and other countries. That's how we have to be thinking of this. And yes, there are some ramifications that will happen in terms of potential this intellectual property and this data and these other pieces, but we have to focus on the issue at hand. And right now, the world needs to get vaccinated as soon as we possibly can.
If the house is on fire, yeah, better put out the fire first before you do other things around the furniture. A good point, Scott. There's also a topic that has been fairly heatedly debated in the press. There's been quite a few articles written, and good articles, good perspectives on vaccine nationalism, and the fact that this is an all for one for all type of a fight. It's not like, one country can vaccinate all their people and then be secluded somehow by the what happens outside. Arnaud, maybe talk a little bit about that and a little bit about why. It seems obvious, but the behavior of certain countries and governments by hoarding vaccines, right? They're not necessarily going into that direction. So why vaccine nationalism can actually be quite hurtful and quite detrimental on the long run for all of us?
Well, obviously, that if you've got 12 billion vaccines produced in the first year, and 10 billion of those are going to 50 high-income countries, you have a problem. This is a problem we have. Now, like I mentioned before, there are 2 billion doses that are going to go to COVAX. That's not enough. I think we need to increase manufacturing capacity right away. And I think increasingly I see companies doing it. I think we probably see, my anticipation is that we will see that J&J vaccines will flow in quite significant quantities to Africa, which is good news. I've got big trust in there. I think we have seen also India starting to export, so borders are open. The vaccines that are manufactured by Serum Institute of India will be made available to emerging economies. So there is hope, definitely. And then, the COVAX facility has put in place a scheme whereby the richest nation, when they have excess supply as compared to their populations, because they have doubled down on multiple vaccines, with the anticipation that not all of them would be good. Actually, the good news is many of them are good. So they end up with excess supply. They will end up with excess supply. And there is a very, very strong call to governments to actually donate those doses that are not going to be used by the populations. That's important because, if variants would emerge, better use those vaccines right away, because, in 2 years from now, even though they would have been maintained at the right temperature or you name it, they may not serve any purpose. So I think donating fast is the right thing to do.
Absolutely. Scott, on the topic of where do we get the right information? And this happened to me literally yesterday. I got a link from a friend, something to do with, okay, this vaccine and this, this story of it's not even a vaccine and this technology. And then I just looked at the website where he had picked it up, and it was a random, I never heard in my life. And I said, hey man, did you check your source? Like, I don't know much, but look, just look at the source, right? And then you kind of know, okay, it's not it. But this is a big problem, right? Disinformation, misinformation, whatever you call it, different people everybody has an expert on Facebook, right? So I guess where do we get the information? Maybe talk a little bit about Convince and all the good information that you put out there, and let's get some valid sources to the population, I guess.
Well, thank you, Radu. And Convince that we put together is an acronym which stands for COVID New Vaccine Information, Communication, and Engagement. And absolutely, the information and communication are key. One of the first pieces that we put out with the National Academies of Medicine in the United States, we wrote that we needed a trusted source. We need to create a COVID information bureau. Now I think we need a COVID vaccine information bureau, just that's trusted, that's non-governmental, that has the appropriate scientific and medical information. So when you mention you and a friend get some data that's on a social marketing site or a social media site, that you need to be able to validate it. So we put together Convince, and this is with Heidi Larson at the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, Wilton Park, which is part of the UK Foreign Development Office, and my group at CUNY, City University of New York School of Public Health. We convened a number of experts, including the ones that Arnaud has mentioned, at CEPI, the Coalition for Epidemic Preparedness Innovation, Gavi, which is the Global Vaccine Group, World Health Organization, and others. And we launched this at the United Nations during the high-level political forum on what to do with COVID over the summer. Long and short of it is that we realized that we need to have an information focus. We have the group in London. We now have business partners to Convince based in the U.S. with the link with the International Chamber of Commerce and International Organization of Lawyers and of Employers and the U.S. Council for International Business. These groups are all trying to put together core data sets of information that business and the learned intermediaries, those of us that have some knowledge, can have on COVID and be able to communicate that to their employees and their communities. The short is we're working to do that. We want to put this in digestible format. We're working with some big multinational companies as well. I think it's fair to say here now that Salesforce is one of those. They have a work.com platform. We're working closely of how we can develop playbooks and toolkits. Hopefully that will be able to set the standard higher in terms of the evidence base and not just say, go look at your local government or national government. So that's a long answer. This is a complex question, that misinformation and disinformation, some of it's sponsored by state groups, others are organic, and others are frankly, maybe even coming from private and public sector groups. So we need to raise it to the highest level that we can, that we need better information on vaccines.
Arnaud, what's your take? And maybe share, because you're doing at the forum.
Well, I think we are certainly, we like to be on the receiving end of everything Convince is doing. So to the extent we can further leverage our 1,200 very large industry partners and convey the Convince information in a way where employers, HR managers, chief health officers can actually educate their employees, and also from time to time their clients and customers. I think we stand behind that goal, and this is where we launched this vaccine information and empowerment in the workplace collaborative. It's called VIEW, which is really looking at leveraging the role of employers. The employers, as we well know, are the most trusted sources of information. So I think when it comes to social media conspiracy theory, I think we have a very, very powerful arm to contradict those false theories as we leverage employers and their trusted voices.
Yeah, I think, Arnaud, that's very well stated. Not only the activities that you've been doing, and yes, how we can work together, but we also, not only the trust barometer that comes out every year, but also in our global survey, our 19-country survey on vaccines, we asked if people would follow their employer's recommendation, and well over half of general population in the 19 countries said yes, that they would follow. So we know how important employers are, and that's also why with Convince we've issued this business partners to Convince a global COVID-19 workplace challenge that companies can sign up to and say, yes, we're going to provide information, yes, we're going to provide access, yes, we're going to be equitable in scope, and we're going to be members of the community and so forth. We can post those specifics. It's easy to sign up, but then you actually have to convey the information and do the work. And both with the work of Arnaud, the World Economic Forum, the work that we'll be doing with Convince and others, we hope to be able to provide that information and activities and playbooks and toolkits for employers.
I'd like to stay on the topic of businesses and employers and getting the information propagated through that channel, right? Scott, you mentioned Salesforce, but maybe let's take one or two examples, right? And also kind of share to the world, because I'm sure that there's also from the corporate side, there's a level of reluctancy, or some of them, would be wondering, shall I do it? Shall I not do it? Right. So let's give some of the examples of the ones that already committed, and maybe what happened or what has happened so far.
Well, I mentioned the work with Salesforce because we're working together to figure out, and actually Heidi and I are going to do one of these global events with them in the next week or two, because big companies, of course, they link with a number of others, not only their clients and others, want information on the vaccine and have the same sort of questions that are coming up. So we need to create opportunities to listen. So it's a two-way piece we need more surveys without more ways of measuring and gauging the sentiment. And we've been doing that, and we hope to do more of it. We're looking at also ways, not just with surveys, but understanding how to build trust. Arnaud mentioned everyone from that HR managers benefit all the way up to the C-suite. Everyone needs to get this kind of information. And we need to figure out ways that this is not just we're no longer in the newspaper era. We're not only in the social media era. We need to figure out the ways that we can communicate at time the information is new and is salient. And that's kind of what we've been working on. Just mention one other piece. You introduced me with the editing of the Journal of Health Communication. We have a whole issue coming out on addressing vaccine communication during a pandemic later this month. And the term vaccine literacy has come up, of how we need to have the knowledge and skills, not only at the individual level, but the knowledge and skills at the policymaker level of how a vaccine works and why you need to invest in it. Not, as Arnaud's mentioning, the 12 billion doses, are those enough? How people realize that, how they're diffused and so forth. So there's a little bit more complexity here than just take a medicine, a one and done. This is an ongoing process, and I think that's how we're all trying to work together.
Absolutely. Arnaud, we're drawing to an end, but I wanted also to get your thoughts in terms of, you mentioned it's important for other healthcare companies to chip in, right? And it has happened, if I'm not mistaken. Sanofi has just, correct me if I'm wrong, attributed some manufacturing sites that they can produce existing vaccines, right? Even if they don't have their own. Do you see more?
The Pfizer vaccine, right? 250.
Yeah. Do you see more of that happening? Can also maybe government step in, and I mean, I wouldn't want to use necessarily the word impose, right? But facilitate, in order to expedite, as you rightfully said, both of you, I think they rightfully said, expedite this manufacturing so that more of us can get vaccinated faster, and then we can prevent that situation in which one variant can render the existing vaccines, futile.
This is an immediate opportunity, and this is a long-term opportunity. Because, governments like Switzerland, Korea, Singapore, France, the UK have all announced their intention to invest into new manufacturing capacity right now. So I think this needs to be leveraged to produce more vaccines. I would like to remind you also that the worldwide capacity for vaccines is largely so also in India, Brazil, Korea, Indonesia, and the participants to the developing countries' vaccine manufacturing network in peacetime, they produce more than 60% of the global capacity of vaccines. Those participants, I think the 40 companies that are participating to the DCVMN could leverage investment and could benefit from investments in manufacturing capacity right now. It's not very expensive. It's not very expensive. I think to actually bring 100,000 dose vaccine manufactured to 400,000 dose in capacity would cost 400 million. You do that 5 times, you got 2 billion more doses, not to even mention the capacity being built in high-income countries. So that's for the short term. I think it needs to happen in 2021, because otherwise we are going to be going to the scenario where the world gets immune in 2024, when we want a scenario where the world gets immune in 2022. So it needs to happen right now. Now, you can question what. So yeah, but then you're left with all this spare capacity. Absolutely not. Absolutely not. I think there is an opportunity to actually repurpose those manufacturing capacity and leveraging novel mRNA platform and actually start innovating vaccines against prototype pathogens, because there are 30 classes of viruses of the 40 that do exist. 30 of those classes, we don't have the beginning of a vaccine. So if you start identifying in every one of those classes prototype pathogens and you bring vaccines against those pathogens to phase 2, then you have a shot at having vaccines in 100 days for the next crisis.
Some excellent pointers. Scott, I'll give you the word for final thoughts, or if you want to build on something that Arnaud has just said, or any final kind of comments.
I mean, I think that's an excellent point of looking at prototypes. I mean, I've served on the CDC Board of Infectious Disease in the United States, and we have not done, and the United States right now does not have the same kind of surveillance and monitoring of variants that they should, in my opinion, and I think that they'll continue to scale this up. We need to do that same sort of tracing around the world to predict what the next ones will be. And that would be a great investment. So I think Arnaud is absolutely right on the 30 plus that are out there. I also like to remind that, we have not solved the AIDS crisis with a vaccine. And we have controlled. AIDS is now no longer an infectious disease that's a death sentence. It has become a chronic disease. But nonetheless, we also need to think that vaccines are one part of the arsenal, and we have to think of the other research that we still need to foster to get better ways to quell this pandemic. I am hopeful that we do the 2022 piece that Arnaud has mentioned. 2024 sounds like it's far away, but I am quite concerned that we will have vaccine hesitancy, which we didn't talk about. It's going to be fairly easy to get, well, easy once you have the vaccines out there, 50% of the population vaccinated. The next 25% to get to 75% is going to be more difficult, but not impossible. To get to herd immunity that we're talking about, we need 80% most likely covered. If vaccines are in the 90% range, that means we need almost 90% of the world's population. That last bit is going to be very, very difficult. There are refusers, there are deniers, there are people that want to continue to wait and see. That's one of our poll survey categories that keep coming out. I want to wait and see. Wait for how long? See what? Learn what? We're going to need financial incentives to get that final 20% vaccinated. It's just not an easy road ahead. And I'm working with Convince. We're mostly working on the demand side. That we need to give the information, the communication, and that E for engagement, these kind of discussions. Business community needs to sign up to this workplace challenge. They need to join efforts to provide the information and the access to vaccines and hope and convince people to take the vaccine, because vaccine in a vial is not going to get us out of this. So that's really work to do that. I appreciate these discussions, the great work of Arnaud and the forum. In transparency, I worked for Johnson & Johnson for 11 years when they bought their first vaccine company or acquired Crucell in the Netherlands. This will be their first global vaccine that they will be bringing to market should it be approved, which is likely, it seems. So I think we all need to figure out ways that we could continue to build the capacity and have the ethical communication that Arnaud, the World Economic Forum, our affiliates, business partners to Convince, all these different councils are working on. So, thank you for this opportunity today. I know that from your last session, I've got a lot of emails. I don't know if this one will be quite the same. And, business partners to Convince, you search for that. You'll find information and can find me as well if there's more questions. Thank you.
Thank you, Scott. So with that being said, we have quite a few other questions, but I'll take you separately and I'll send it to you separately. But I want to thank both of you. I also want to encourage our viewers and who the different platforms that we are on. Do look up Convince. Do look up Scott. Obviously, follow World Economic Forum and the great work that Arnaud and the team is doing on the healthcare side there. do follow COVAX, CEPI. There's a lot of great information out there. Let's all chip in with you know, I mean, we're trying to do our small bit here at Elcott Global by putting this together, but I think all of us, if we put our minds to it, we can do a little bit. Scott, Arnaud, stay healthy, keep up the great work, and yeah, let's get this done.
Great.
Thank you very much. Bye.